Hey guys, my name is Trent Woods, and today I want to talk to you all about something that is actually of great importance in today's world. The issue here is how we're currently treating those with mental health disorders. Right now, we're very heavy on using pills and other types of drugs to hopefully treat those with mental health disorders. So, could there be a better way, other than just throwing different combinations of pills at these patients? The facts are is that studies have shown there might be a better way, and that's actually prescribing exercise as a treatment to those with mental health disorders. So why do I care about this though, and why should you care about this? The facts are is that there are millions and millions of people across the world that are affected in one way or another by mental health disorders such as stress or anxiety or depression. I can almost guarantee you that someone you know, someone in your family, one of your friends, someone is affected by one of these disorders. So I want to start off by giving you all a little bit of a background and a little bit of a history on using exercise as a treatment for mental health disorders. Is this just an idea, or does putting it into action actually work? And the facts are, in the past 10 or so years, there have been doctors and licensed physicians to actually start prescribing exercise as a treatment. They've had very much success doing so. According to a study done by Psychomatic Medicine, they charted people, depression patients, and some depression patients were prescribed exercise, some were prescribed medicine, and after 6 months, 90% of those prescribed with just exercise had recovered from their depression, and only 60% who were prescribed medicine had recovered. So that right there should be enough proof that it does work. 90% of people who were prescribed exercise were cured of their depression. According to HelpGuide.org, exercise can treat mild to moderate depression as effectively as antidepressants. So it's more than one website, it's more than one study that backs this information. But how does exercise actually, help those with depression and anxiety? What's this kind of science behind it? When you exercise, endorphins are released through your bloodstream. Endorphins are the things that make you feel good. It makes you feel just better about yourself and just happy. Exercising gives you more self-confidence. It also makes you feel as if you've accomplished something, rather than just sitting on your couch and watching TV and throwing a few antidepressant pills in your mouth. You actually feel accomplished that you've gone to the gym or you went for a walk around the park. You feel accomplished that you've actually done something. You feel as if you're truly helping yourself. According to Jennifer Carter, who is a PhD and also a licensed physician, I often recommend exercise for my psychotherapy patients, particularly for those who are anxious or depressed. So that's a very educated woman and a very respected physician who herself is actually prescribing exercise as a treatment. But why are we not doing it more today? If there have been numerous doctors to back this information, numerous studies to back this information, so why is exercise not being prescribed as a treatment in the mainstream, world? Why is it not more popular? The facts are that money rules everything. Pharmaceutical companies, they probably don't like this idea of prescribing exercise as a treatment. Exercising is free. You don't have to pay anything to take a walk around the park. These pharmaceutical companies right now, they know that these patients rely on these drugs, so they can charge thousands and thousands of dollars for these bottles of pills, knowing that they're going to make money because these patients, they don't have a choice but to pay that premium for this medication because they just hope that one of these pills will help them feel better. So they're willing to pay the outrageous amounts of money these pharmaceutical companies are demanding in order just to hopefully feel better. They don't know that, exercising is free and it can actually maybe even do them better than the $1,000 pills that they're popping into their mouth. So why aren't we trying to do something that's free? Why are we not prescribing something that's free first? Why are we not prescribing exercise first rather than expensive pills? Not to mention, exercising is far better for the long term than taking pills. Getting addicted to exercise is much better than getting addicted to pills. I mentioned earlier that you're throwing all these different types of pills into your body, hoping that something will work for you. But I don't think we realize the effect that this can have on you. You know, your body isn't made to take all these weird combinations of chemicals. You know, over the long term, you're actually going to be hurting yourself trying all these different types of medication. There's no way your body can benefit from that in the long term. So I think one of the main reasons that this hasn't been more adopted into the main world is definitely the pharmaceutical companies. You know, they're looking out for their own profits. They don't care about the patients. They don't care about, you know, giving them the best type of treatment. The only thing they care about is making their money. So they're going to keep trying to hide this crucial information in these studies and the science behind using exercise as a treatment as much as they can from the world, because they want to keep making their profit. So in conclusion, you know, why should we use exercise as a treatment in today's world? It's been proven to work. Multiple studies and multiple doctors have backed this information and actually used it in the real world. It's going to greatly help the economy. You know, the less money people have to spend on their pills and all their antidepressants and other drugs for their mental health disorders, the more money they can spend elsewhere. And not to mention, it's going to help these patients in the long term. Exercising is far, far better than popping tons and tons of pills into your mouth for the long term. So thank you for listening, and I hope you learned something today. Appreciate it.